Catheter management is a crucial aspect of nursing care, as catheters are used for a variety of purposes, from feeding to urine evacuation or medication administration. Each type of catheter requires specific care and handling to avoid complications. Types of catheters. 1. Nasogastric tube. This is a tube inserted through the nose, passing through the esophagus to the stomach. It is used for administering food, medications, or decompressing stomach contents. 2. Nasojejunal tube, similar to the nasogastric tube but extends to the jejunum, the middle part of the small intestine. It is useful for patients who cannot properly absorb nutrients in the stomach. 3. Foley catheter. This is a bladder catheter inserted through the urethra to drain urine. It has a balloon at the end that inflates to keep the catheter in place. 4. Urinary catheter. Similar to the Foley catheter, it is mainly used to evacuate urine temporarily in patients who cannot do so on their own. Procedures for inserting catheters. Catheter insertion must be done carefully and with strict procedures to minimize the risk of infections and other complications. 1. Nasogastric tube. Preparation. Explain the procedure to the patient and make sure they are in a semi-Fowler position, semi-seated. Measurement. Measure the distance from the tip of the nose to the ear, then to the sternum, to determine how much to insert. Lubrication. Lubricate the tip of the tube to facilitate insertion. Insertion. Gently insert the tube through the nose, asking the patient to swallow as the tube passes through the throat. Derification. Verify that the tube is in the stomach by aspirating a small amount of gastric contents and checking its pH. Fixation. Secure the tube in place with adhesive tape. 2. Foley catheter. Preparation. Wash your hands and use sterile gloves. Ensure the patient is lying on their back with legs separated. Lubrication. Thoroughly lubricate the catheter before insertion. Insertion. Gently insert the catheter into the urethra until you see urine begin to drain. Balloon inflation. Once the catheter is in the bladder, inflate the balloon with sterile water to keep it in place. Fixation. Secure the catheter to the patient's legs to prevent movement. Catheter care and maintenance. Once the catheter is in place, proper maintenance is essential to prevent infections and complications. 1. Hygiene. Keep the insertion site clean and dry. Wash the area with water and mild soap daily. 2. Verification. Regularly check that the catheter is properly positioned and functioning correctly. 3. Hydration. In the case of a nasogastric or nasojejunal tube, ensure the patient is well hydrated and that the tube is not blocked. 4. Regular drainage. If it's a urinary catheter, regularly empty the collection bag to prevent overflow. 5. Observation. Observe the patient for signs of infection such as fever, pain, redness, or swelling around the insertion site. Complications and their management. While catheters are vital tools in healthcare, complications can arise and must be managed quickly and effectively. 1. Infections. These are the most common complication and can occur at the insertion site. Maintaining strict hygiene and monitoring for signs of infection are crucial. 2. Blockage. Catheters can become blocked by mucus or debris. If this occurs, try irrigating the catheter with sterile saline or consult a professional. 3. Displacement. If the catheter is displaced, do not attempt to reinsert it without professional supervision, as this is mucus or debris. If this occurs, try irrigating the catheter with sterile saline or consult a professional. 4. Leakage. If the catheter leaks, check if it is properly secured and if the balloon is adequately inflated in the case of a Foley catheter. Final considerations. Managing catheters is an important responsibility that requires a meticulous approach and detailed knowledge of the procedures. Be sure to follow all instructions and recommendations to maintain patient safety and well-being. Do not hesitate to seek professional help if complications arise that you cannot manage on your own.
I am Nurse Eti. Please hit the notification button and subscribe. Thank you.